Hello, and thanks for joining us for this video case tip. I'm Bryn McBride of ABC for Health. Today we're going to answer the question of why there's no such thing as a quick answer when you're dealing in the world of healthcare and coverage. Now, we do have a couple links that we share with you at the end of this video, and you can visit those at any time by clicking on that information button. How many times have you had somebody come into your office and say, I have a really quick question. I just wonder if someone under the age of 19 can get Badger Care Plus. Or have a really quick question. How much do you have to be working and still get Badger Care Plus? Or can I add a child to my private insurance? I have a real quick question. Anything that starts with a real quick question ends up not necessarily being a quick question, and there's no such thing as a quick answer. Why? Because there are so many variables to getting the answer right. So a quick answer to a quick question most likely will be a wrong answer. We're going to talk about a couple ways you can verify that you are getting a little bit more information and you're providing the best answer to the family or the individual that you're talking to. And it's easy to describe it that way. Someone that comes in and has a quick question might be pushing for you to answer quickly so they can be about on their day. The way to answer that is, you know what, I'm going to need to gather a couple more key metrics. I need to gather a little bit more information so that we can provide the best answer for you. While doing this, assess urgency. Is there a healthcare crisis that needs to be tended to apart from the coverage question? Make sure that you're keeping your radar out for that and not just shutting down the quick question and taking your time for the intake interview. But that's an issue I think most people can assess quite quickly. What we will talk about today is some of the important variables that you might need to clarify to take that quick question into one that's a more thoughtful, explained question and answer session. And this starts with a very good intake variable. You're going to be asking family size. You want to know a little bit about household income. You're going to be asking about ages and dates of birth, citizenship and immigration status, access to insurance or current healthcare coverage, and residency. So for folks that are hearing this, they're saying, wow, these variables sound kind of familiar. Those are all of the eligibility variables, both financial and non-financial. That's the first line of questioning to see if someone's eligible for Badger Care Plus. Those are your key variables when talking to someone. So if they say, hey, is someone over the age of 19 eligible for Badger Care Plus? Well, you've got that age variable, but you don't know family size and number of tax dependents and household income. You don't know the immigration status. You don't know about any current coverage options that are out there, and if they're even living in Wisconsin. So that's a way to slow the question down and ask a couple more questions to round out that picture. But there's also more variables. There is assessing employment. Is anybody in the home pregnant? Is the woman you're talking to pregnant? Is anybody else in the home pregnant? It might change the household size depending if they're applying for Badger Care Plus or the Marketplace. Sources of income. Some are counted, some are not counted. Assets. Not necessarily relevant for Badger Care Plus, but maybe they're looking at a Medicaid program. Veteran status, race, ethnicity. Why would that be important? Is someone an American Indian and applying for Marketplace coverage? That might change eligibility. Transitions that are coming up, disability determinations. As you can see, there are a number of variables. Medical debt. Maybe someone could spend down their income and meet a deductible for Badger Care Plus and then become eligible. There are a lot of variables and every one matters for determining the best route of connecting that person to health care coverage. But this is a lot to remember when you're talking to a family and trying to remember the important variables. So we've categorized it into 4 groups of questions. Somebody comes in with a health care coverage question. Remember, you need to simply clarify 4 areas, and that includes household. You're going to see who's in the household, who's related by tax dependency, and if there is anybody that is pregnant or if there's anybody else living in the home that might be relevant for coverage purposes. You're going to clarify income. What's the current household income? Who is making the money? And what are the sources of income? Clarify coverage. Do people have access to coverage now? Is it through work? Does it matter? Is coverage ending? Will coverage be starting? Condition. Does anybody meet a disability determination? Are there any children with special health care needs in the home? And maybe we should be looking at a little bit more robust service package for that. So if you remember these categories of questions around household, income, coverage, and condition, that's going to help frame up that first interview that you have with that family. Avoid giving quick answers to quick questions. And this happens a lot, you might find, on teleconferences and listservs. See, there are a lot of great advocates working together to try to resolve issues that families come into. But sending out a question by email of, is a 19-year-old eligible for Badger Care Plus, with none of the other information, you're going to be getting answers out of left field, out of right field, people asking clarifying questions, other people giving an answer. It's not a productive use of anybody's time. Instead, try to make a better, more informed question and referral with the family you're talking about. We'll talk about some of those best practices, but we can't stress enough, certainly don't guess. If you only have bits and pieces, it is not in the patient's best interest or the family you're talking to say, well, I think you're eligible for private insurance, so skip Badger Care altogether. That's not the right course when working with a family. The stakes are too high. Here are some best practices. Set aside a little time to do a proper intake interview. Assess if the person you're talking to has that time right now, or if we should schedule an appointment for them to come back. Ask clarifying questions. The best place to start when someone has that quick question is to say, why don't I ask a few clarifying questions and see if we can't narrow down your options and get you pointed in the right direction. Compare the answers you get to coverage rules. We're going to share the link to the Badger Care Plus eligibility handbook, to Marketplace, healthcare.gov, where there's an extensive Q&A and glossary where you can start looking up rules and answers. And then make informed referrals. Maybe you're not the right person to be answering the question because you've gotten to the point where there are too many variables and you're not sure how they fit together. With that family, you can call and find some additional help. And we'll share a couple of those resources with you, like the County Income Maintenance Consortium, where you can talk to an income maintenance worker and see if this person should just start a Badger Care Plus application. Do good follow-up. Let's say you make a referral or a deadline is approaching. Make sure that you reconnect with that family. Maybe they only had 10 minutes to get that interview started, that intake interview started, and only answered a couple of your questions. Maybe you should schedule a follow-up, or maybe once you consult with colleagues, you realize there are more questions you hadn't asked. Make sure you can reach that family so you can continue that conversation later. And again, deadlines are of critical importance. Sometimes the end of the month is important. For Marketplace, sometimes it's the 15th of the month. Make sure you're aware of any deadlines, or maybe verification items are due. When will those be due? Make sure you have that calendar with the family so they don't miss an important deadline. So you can see what started as a real quick question could turn into a much bigger conversation with the intent of making sure that you are getting people connected in the right direction. The consequences are too high if you give a quick answer and make a mistake. Like I said, that Badger Care Plus eligibility handbook is a great resource for comparing answers to the rules and sharing that information with families. Access.wisconsin.gov is how you can go through the Am I Eligible for Badger Care Plus interview. There is a separate button on there beyond using access.wisconsin.gov to apply for Badger Care Plus. Healthcare.gov is a wealth of information. They have a glossary. They also have a frequently asked questions section that covers most elements of private marketplace insurance. And again, those income maintenance offices clustered in consortia are a great resource for families when they're starting an application and troubleshooting an application. Thanks for joining us for No Quick Answers. And if you have any questions, you can certainly use us as a resource. You can visit us at healthwatchwisconsin.org. Thanks for watching.